Hello, I am Colby Lopez, a student and student government senator/treasurer at WVU Tech and politician from southern West Virginia. This will be a video in which I discuss current events in state politics. So there is currently a bill in the West Virginia Legislature relating to needle exchange programs. These programs are set up specifically to limit hepatitis and HIV/AIDS spread through the use of needle injection drugs. These programs, of course, are part of treating the drug epidemic as a health issue instead of a criminal issue, which makes it easier for victims of the drug epidemic to seek professional help. These needle exchange programs exist here in West Virginia, of course, which is why there is a bill in the legislature. As I mentioned, these programs are very helpful to people who are victims of the drug epidemic. If we were to continue to loosen criminal penalties and truly treat this as the healthcare issue that it is, these programs would be very much more helpful. Doctors as generally support programs such as these, as it does reduce HIV and hepatitis rates, which of course protects the general population, even if they don't use these injection drugs, because if someone who is not a victim of the drug epidemic has contact with someone who is a victim who has used a dirty needle and therefore has hepatitis or HIV, then of course that will spread throughout our population here. So needle exchange programs are not only safer for those suffering as victims of the drug epidemic, but also ensures the safety of our community at large. However, first responders and the public alike are afraid of being stuck by dirty needles that are disposed in public, as there is a bit of a needle litter problem here in West Virginia. First responders, as I mentioned, are afraid that whenever they're responding to an overdose or otherwise that they may be stuck by a dirty needle, which they fear that needle exchange programs increase the likelihood of. And of course the public believes that there is not enough oversight into me needles in public places. As I mentioned, there is a needle litter problem, and also to be clear, not all needles given out during needle exchange programs are eventually returned to that program. And so that is why there needs to be oversight to know if these needles have been exchanged to another program, whether they have been disposed of properly in the same way that someone who uses diabetic needles would properly dispose of their used needles, or otherwise being out in the public where we do not want them to be disposed of. Seeing this need for oversight, legislators have decided to craft a bill. However, while nominally what the bill does is require a license to create needle exchange programs to provide some oversight, what it effectively does is it abolishes needle exchange programs and prevents new ones from being created. And obviously this will lead to, so while this aims to benefit public health by reducing needle litter, in reality it will negatively affect the public health by increasing the spread of HIV/AIDS, as well as increasing the spread of hepatitis. Additionally, I would not be surprised to see an increase in needle litter due to the lack of exchange programs. So as such, there needs to be a way that we can both provide oversight without passing this horrible bill that will actually harm public health. What this bill should do is create a board of medical professionals to oversee needle exchange programs in the state, alongside requirements to implement suggestions made by a group of medical professionals and first responders prior to passage of the bill that I'm suggesting. Among them, methods of reducing dirty needles in public places or other dangerous areas. This current bill, not the bill I just suggested, has passed the Senate and is currently in House committee. As I have hopefully explained, we need to ensure that this bill does not go into effect to help our public health crises, not only of the needle litter, but also to ensure public health is maintained for victims of the drug epidemic, ensuring that we treat this as the healthcare issue that it is, not a criminal issue that it is not. Other than, of course, those who distribute things. I am not suggesting that we... Okay, so whenever I say that this is a healthcare issue rather than a criminal issue, those who use drugs are victims, and therefore that part is the healthcare issue. Distributors are a criminal issue, and I don't just mean the guy down the road with heroin, just the heroin dealer down the road. I mean opioid manufacturers who dump millions of pills into small towns. Those are also criminals and need to be held accountable. Additionally, I believe that while I am not versed in the drug trade, as I have not done anything, though I do believe that marijuana should be legal. I'm fine if you smoke marijuana, cigarettes, cigars. I'm fine if you drink alcohol, all that. I've just never done even any of that, so, you know. But while I'm not versed in any of that, I would hope that there are certain distributors who would only distribute to those who are, for instance, in the medical fields, who would distribute technically illegally in order to reduce the complications of related to going off of a drug, withdrawal symptoms, those who just give the bare minimum out instead of those who specifically distribute for profit, which I would definitely say that the majority that do distribute are for profit. I am not under the illusion that there are a majority, plurality, or even significant minority who do what I said. But I would not consider a nurse who provides opioids to someone to avoid withdrawal symptoms a criminal, even though they technically did so illegally. As all they are doing is ensuring withdrawal symptoms are not torturing an individual. I am not aware of any person who has done that. I am just hopeful that there are people who would do that for a friend or family member in need. But anyways, now that I'm done with that tangent, these needle exchange programs need to stay in place so that not only are we dealing with blood-borne and otherwise needle exchange, repeated use of needle transmitted diseases are reduced, but also to ensure that our that public health is properly attended to, not just those who are not victims, but also those who are victims of the drug epidemic. Yeah. So, as I said, that has the bill that would eliminate these important programs for community health has already passed the state Senate and is currently in a House committee. Anyways, please like this video, share it with family and friends, and subscribe to my YouTube channel, making sure to hit the bell icon. Please also check out my social media, Instagram @LopezForChange, Twitter @LopezForChange, Snapchat @LopezForOakHillWV, and Facebook, facebook.com/Colby.Lopez.12, which all should be linked in the description. Please stay safe and de-stress. I am Colby Lopez, and I approve this message.